Effective Preceptor Series. Teaching Strategies for the Ambulatory Setting. We know that you have a busy schedule in the office, and sometimes having a learner just seems like something else added to your to-do list. So, in this video, we will review a teaching strategy called the 5 microskills model. This has been shown to be both highly educational for the learner and quite effective for the preceptor. What is the 5-step microskills model? This model was developed in the early 1990s by Naher and colleagues. It creates a framework for teaching medical students in the outpatient setting. The microskills are designed to promote independent thinking on the part of the student while allowing an opportunity for constructive feedback. How does it work? The preceptor uses a series of 5 questions in the context of a patient visit to encourage the student to think like a doctor. Therefore, the student can develop a rationale for the assessment, come up with a differential diagnosis when appropriate, and think of the next steps in the patient workup. The questions also lead the preceptor to provide formative feedback, teach briefly about the patient's problem, and gently correct any mistakes made by the student. How to use microskills when precepting a student-patient encounter. Microskills work well when precepting in the outpatient setting. Ideally, the student has seen the patient independently and returns to the preceptor to present the history and any physical exam maneuvers that have been performed. The 5 microskills are: 1. Get a commitment. 2. Probe for supporting evidence. 3. Teach a general rule. 4. Reinforce what was done right. And 5. Correct mistakes. The preceptor can then use the following questions to guide the student's thinking. Get a commitment. Arguably, this is one of the most important microskills. The preceptor asks an open-ended question to get the student to commit to a differential diagnosis or assessment of the patient's problem. For example, what do you think is going on with this patient? This simple question moves the student from reporting patient data to interpreting that data and making a commitment to consider different diagnoses or steps in the workup in order to determine the final differential diagnosis. Probe for supporting evidence. After the student has made the commitment to discuss thoughts about possible diagnoses, the preceptor asks the student to explain the rationale behind his or her differential. The preceptor challenges the student to explain the reasoning. What items in the history or physical exam made the student consider the differential diagnosis and the next step in the workup? Such questions guide the student to think about moving from reporting to interpreting data. During the discussion, the preceptor may evaluate the depth of the student's critical reasoning and fund of knowledge. Teach a general rule. After the student has had the opportunity to develop an assessment backed up by verbalized reasoning, the preceptor may take a moment to do some targeted teaching about the specifics of the patient's problem. In general, this teaching is brief and designed to communicate one specific point derived from the case. Reinforce what was done right. A commonly neglected aspect of teaching medical students is the delivery of useful feedback. The 4th microskill focuses on giving positive feedback on any or all aspects of the patient encounter. Positive feedback may touch on the student's interaction with the patient, the quality of oral presentation, the ability to develop an assessment, or the student's reasoning process. Students strongly desire feedback, and this microskill formalizes the feedback component. Correct mistakes. The flip side of positive feedback, correcting mistakes, involves gentle delivery of constructive criticism and often points the way for students to pursue self-directed learning. The preceptor clarifies misunderstandings about parts of the patient case and urges the student to identify knowledge and reasoning gaps. So here's an example of how the microskills are used in the context of a case. So, in summary, this is a 22-year-old G0 with a high fever and abdominal pain.
What do you think could be going on with her?
I think she has pelvic inflammatory disease.
What makes you think she has PID?
She has complaints of abdominal pain and fever that's associated with cervical motion tenderness and abdominal peritoneal signs.
Excellent reasoning. Could anything else be going on?
It is less likely that she could have appendicitis or pyelonephritis.
What are the next steps for this patient?
We should get a white count and send her home with antibiotics.
I agree that we should obtain a white count, assess for gonorrhea or chlamydia, and probably also an ultrasound to rule out an abscess. Although you were correct in thinking about antibiotics, due to her high fever and peritoneal signs, we should consider inpatient treatment with IV antibiotics. We should also check a pregnancy test in all our reproductive age patients. Please look up decision-making about outpatient versus inpatient treatment of PID.
Both direct and indirect evidence support the effectiveness of this teaching model. Direct evidence indicates that traditional precepting places more focus on correct diagnosis and treatment of the patient, whereas the microskills model leads to a higher degree of student participation in decision-making. It also fosters the process of the student moving from reporter to interpreter while maintaining excellent quality of patient care. Preceptors cite several advantages of the microskills model. They feel that they do a better job in identifying level of clinical skills and give better, more useful feedback than with a traditional model. Students rate preceptors as better and often say that they motivate them to read independently. When probed for the rationale behind diagnosis and management decisions, students may develop a stronger need to know, motivating them to pursue outside study. Using these microskills, students may derive a high quality of learning experience, and the preceptor should experience minimal impact on his or her productivity.